Now, I want to turn to pelvic mesh. This month, 2 years ago, Dr. Henrietta Hughes published her report laying out a plan for compensation for women harmed by pelvic mesh implants. The Hughes report set a deadline for the government for action, which has just passed without any action. Pelvic mesh implants were once seen as a revolutionary treatment. They were the gold standard for women that were dealing with prolapse or stress incontinence. But thousands of women have been left with severe difficulties after receiving them. Some had to quit their jobs, live with acute pain, or face life changing complications from the procedure. By 2018, the use of surgical mesh was largely suspended in the UK. In 2020, the Cumberledge Review found that they had caused avoidable harm to tens of thousands of women. So Dr. Hughes is with us. She is England's first patient safety commissioner. We also have Kath Sansom, a long-standing advocate for compensation and the founder of Sling the Mesh campaign group. Good morning to both of you. I'm so glad to have you. Kath, perhaps I could start with you, if you wouldn't mind sharing your story with our listeners.
Yeah, so it's back in 2015, and I was suffering what turns out to be mild bladder leaks at the time, but I went to my GP, who was put me forward to the local hospital, and I was recommended this particular treatment. I was told of no risks at all, and in fact I assumed it would be a bit like a contraceptive coil. That's how easy I thought it would be. I was told I'd be back at my desk within 2 or 3 days. So at the time I was working as a local journalist in the local newspaper, but I also ran my successful photography business doing weddings and children's portraiture. So I felt confident to have a wedding booked 2 weeks after this particular surgery. And I came out in hideous pain. At first I thought, well, that's what you have to expect after an operation. But the pain got increasingly worse to the point where I could barely walk, I could barely sleep. And within days, I knew I had to find somebody else to cover this wedding for me 2 weeks later, because I knew I wouldn't be able to do it. And I'd known this family really quite well. I'd photographed their children on numerous occasions. And I was a combination of upset and angry that this had happened. So literally within 2 weeks of my surgery, I decided to set up a campaign. And within a couple of months, I'd set up Sling the Mesh with 20 women I'd connected with online. And there's now more than 12,500 members on the Facebook support group from around the world.
So that is just over a decade ago. And I'll find out exactly whether you feel you've made progress. But I do want to bring Dr. Henrietta Hughes in here. You saw a deadline, a timetable for action by the government. Your report was published 2 years ago. Where are you?
So I was asked to do this report by the Department of Health, and it wasn't a question of whether redress or compensation should be given. It was about how it should be given. And so I provided advice to ministers and then published the report, the Hughes report, in February of 2024. And because of the very detailed information I was given by patients like Kath and others who shared really sensitive personal information with me and my team, I really could see that the situation that people were facing was in crisis. People had lost their jobs, they'd lost their relationships, they'd lost their homes in some cases. And so the financial crisis that people were suffering required urgent action. And that's why I set out an interim scheme to make quick interim payments to relieve some of that financial pressure. And I put a deadline of 2025. But I still haven't received a response from the government to my report 2 years after it was published. And I really would like a much more speedy action taken by the government to really listen to those tens of thousands of patients who've been harmed by pelvic mesh and also valproate, a medicine used for epilepsy.
And that with the valproate, it was given during pregnancy and the babies were affected for women that had used it. You talk about tens of thousands. Do we have an exact number of how many would be due compensation in your eyes?
It's estimated that up to 10,000 women were harmed through the use of pelvic mesh, and that around 20,000 children were exposed to valproate during pregnancy.
You outlined in your report 2 stages of compensation. Can you tell me why that is?
The record of who had mesh and who was harmed by mesh are so scanty that we don't actually have a detailed list of all of those who've been affected. So the purpose of the interim scheme was to help identify women who had been harmed through the use of pelvic mesh. And then my recommendation was for a second stage of the scheme by working with those who'd been harmed to understand exactly the issues that they were facing, and then to be able to match the level of compensation to the level of harm that had been carried out through that intervention.
And with that interim payment, that first payment, £25,000, if I've understood correctly, let me turn to you, Kath. I mean, what difference would that make?
It would make a huge difference. In the first instance, it would be validation of their experience, of their suffering, of what they've been through. We all trusted our doctors because that's what you do. We were told it was gold standard, minimally invasive, low risk. So it would validate their voices. But in a lot of cases, financially, these women have been so impacted. So many in our group have either had to give up work, reduce their hours. Marriages have broken down because of the stress. People have had to remortgage their homes to try and pay for private mesh removal treatment because they can't wait any longer on these long NHS waiting lists. And of course, the mental health impact is absolutely huge. And I think it feels very cruel that they've been harmed by something that they trusted would help, and then they're being ignored, and the government aren't stepping in to give them the compensation they deserve.
Dr. Henrietta, I mean, you say that you haven't had the response from the government and that you want to go to Downing Street directly about this. What's your plan?
Well, when the 2 years after I'd given the confidential ministerial advice came up, and I still hadn't had a response, I used the powers under the Act that my role was formed by for the very first time to request more detailed information about when ministers had received briefings and what meetings had happened. And that came back a month later, and I was very pleased to receive that because it gave a lot more information about which other government departments, including Number 10, had received briefings on this. And I very much welcome the support from the Secretary of State for Health and Social Care and the minister involved to really be doing everything they can to provide non-financial redress. That includes, as Kath mentioned, mesh removal, but also in terms of other systems that are being put in place. But when it comes to the financial side of this, I do believe that we need to make sure that all the government departments who have a part to play are able to really step up to the plate here. And that's where, I will then pursue this to whichever government departments I believe, including Number 10, may be helping to be able to understand what information is missing to be able to respond to my report. And I stand here ready to help with that.
We did contact Number 10. They pointed us to the Department of Health. The statement is: we recognise the significant impact that sodium valproate and pelvic mesh have had on people and their families. It's a complex issue, and our priority is to ensure any response is fair, balanced, and sensitive to those affected. We are carefully considering the recommendations within the Hughes report in collaboration with the relevant departments, and we aim to provide an update in due course. Kath, when you hear that?
It's a double-edged sword. Half of you feels confident that something is actually going to happen. I mean, Wes Streeting last week says he wants to be the health secretary that actually delivers on the Hughes report. And half of the page were delighted, and the other half were very cynical, saying this is just word candy. Is anything actually going to happen? And, I must impress on the government. These women need financial support. They've had their lives irreversibly harmed through no fault of their own, and the financial hit that everyone is taking, including myself, is huge, and it feels very cruel to keep these women hanging on, waiting for a response.
Were you able to get a date with Number 10, Dr. Henrietta?
No, I'm yet to contact them, but I also welcome the announcement that the Secretary of State made. I think this is something which is really important, that, as Kath said, these are people, women and children, who, through no fault of their own, have been harmed through these interventions. And, in terms of all of the things that we want to do to keep people safe, I do feel that that is the first responsibility of government. And that is why I will be following this up. It does feel very much like unfinished business.
Kath, if you could speak to the ministers, or indeed to Number 10, what would you say?
deliver on the Hughes report. And again, I can't impress enough how this scandal happened because we trusted our doctors. The regulators fell asleep at the wheel, and we trusted the scientific literature that actually had deep flaws in it. So we must not let a scandal like this happen again. We've got to be more curious about the scientific literature supporting new healthcare treatments, and don't keep these women waiting.
How are you doing now, Kath?
Well, I'm not too bad. I was so lucky. I managed to get a mesh removal 7 months after insertion back in 2015. So I feel extremely grateful that I've had one of the best recoveries of the women within the group, and even my health is still impacted. And that's why I fight so hard on behalf of those who haven't been so lucky.
Kath Sansom is a campaigner and founder of Sling the Mesh. Thank you so much for speaking to us. And Dr. Henrietta Hughes, Patient Safety Commissioner, and also author of that report that was published 2 years ago, who is calling for action. Thanks to both of you.